Anyway, this is a study showing that there is higher prevalence of stress among Holocaust survivors. So even chronic stress for 60 years, 6 decades after what they felt there was still associated with increased prevalence of fibromyalgia. And this is an interesting study, I think. There is a city called Sderot that was constantly bombed for 7, 8 years. And of course, people didn't like there, the inhabitants, and they suffered from stress and stress symptoms. And we interviewed 1,000 random subjects in this city and compared them to 1,000 random inhabitants of a nearby city that was not exposed to such a stress. And we found that in this city, there is significantly increased prevalence of chronic widespread pain, and also that 10 different somatic symptoms, including pain, including headache, fatigue, stiffness, blah, 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 were all more prevalent in this city. And of course, it was associated with the stress. I don't show you the slides here because it's too elaborate. So this is another clue that chronic stress, persistent stress, even in low intensity, can predispose eventually to the development of pain. Now, when you have the triggering factor like stress, trauma, and you have the right or wrong, it depends on how you look on it, a genetic makeup, you can develop central dysfunction. But what is interesting that the same genetic makeup, the same triggering factors can bring to different syndromes, not only to fibromyalgia. So that's how patient with IBS starts, with chronic fatigue syndrome starts, etc. Now, is it important to diagnose fibromyalgia? And I'm referring to the patients here. Of course it's important. Why? Because even just the diagnosis of fibromyalgia improved the health satisfaction without even starting to treat the patient. Just the diagnosis itself is an essential component for successful treatment. Now, the other question is whether it's important to diagnose fibromyalgia for the society. And here, of course, we are facing in different countries, I'm sure that it's in Spain, in Mexico, everywhere, that the governmental authorities are afraid for diagnosing fibromyalgia. They're afraid because they think that it will cost a lot of money to treat these patients for the society and for the taxpayer. But in fact, I'm going to show you 2 studies that shows the opposite, that it's good for the government, not the patient, the government to diagnose fibromyalgia. One is this. This is a study showing that just immediately after the diagnosis, those are fibromyalgia patients, immediately after the diagnosis, there is a significant decline in tests, laboratory tests that are performed in fibromyalgia patients. And the other study shows that just after diagnosis of fibromyalgia, there is a decline in tests and imaging that are doing on fibromyalgia patients, on referrals to physicians, to specialists, on referrals or visits to GPs, and on use of drugs. So I think this is the argument that we should come to the government. Not that, listen, it's not fair not to treat patients with fibromyalgia, they are suffering, we are human beings, etc. Those are politicians. We should talk to them with arguments that they can understand. And if they understand that it will cost less money for them, maybe it will convince them. Now, what about the management of fibromyalgia? This slide shows you already the complexity of the problem. Although I'm coming from the Holy Land, we don't have a miracle drug that you take today and you get up in the morning without fibromyalgia, unfortunately. So it shows you that the treatment or the management of fibromyalgia is multimodal and multidisciplinary. And it involves drugs, it involves conventional medicine, non-conventional medicine, complementary medicine, patient education, and psychological techniques. So you have to do a lot of different modalities, therapeutic modalities to improve. So what are the aims of the treatment? We have these triggers, bad genes and poor environment, and then we develop the symptoms. Once you have the symptoms, you have functional consequences of the symptoms, psychological and behavioral consequences. And now, these functional consequences are resulting in poor sleep, decreased activity, increased distress, maladaptive illness behaviors, etc. And actually, they reinforce the symptoms, increase the symptoms. So we have to treat these symptoms and their functional consequences. We have to treat the symptoms with drugs and those consequences with the other therapeutic modalities. I'll skip this elaborate slide. So, what drugs are we using in fibromyalgia? There is evidence, strong evidence, for the use of the dual reuptake inhibitors, such as the tricyclic compounds, amitriptyline, the old good amitriptyline that I think is from the time of Jesus, is still working today. And then you have the newer SNRIs and NSRIs, like venlafaxine, milnacipran, and duloxetine. And you have the anticonvulsants, like gabapentin and the newer pregabalin, Lyrica, and all those are quite effective for fibromyalgia. Now, 3 drugs have been approved by the FDA for fibromyalgia. This is the pregabalin, the duloxetine, and milnacipran. Unfortunately, they were not approved in Europe, you know that. God knows why. I am sure that there are political issues there as well, but now we are in the situation that patients who want to be treated with these drugs should buy them, and they are quite expensive, I think. And we have this feeling that the mixed, sorry? We have the feeling that the mixed antidepressants are more analgesics than the other antidepressants. Now, there are a couple of systemic reviews that shows the effectiveness of treatment with antidepressants. This is one systematic review showing that those different antidepressants are quite useful. The same group has provided a meta-analysis of treatment with antidepressants, and you see that they found that antidepressants medications are associated with improvement in pain, depression, fatigue, sleep disturbances, and health-related quality of life in patients with fibromyalgia. Many studies have shown the usefulness of other drugs like milnacipran. We're not going to review all these drugs in detail. Duloxetine, there are many studies on duloxetine, Cymbalta, in the dosage of 60 milligrams and 120 milligrams in fibromyalgia patients. And then there is a new drug, a fairly new drug in the field of fibromyalgia, which was used for narcolepsy and sleep problems, sodium oxybate. There are some new data showing that it can be helpful. And as I mentioned already, there is a logic to treat some patients with fibromyalgia with dopaminergic agonists, and this is one study showing that pramipexole, a dopaminergic agonist, is useful in fibromyalgia. And then we have many studies showing the usefulness of pregabalin or Lyrica in dosage of 300, 450, and 600 milligrams. And this is an interesting study. This is a meta-analysis of the efficacy and safety of Lyrica, but from data that were recruited from the company, the raw data. And they came with the conclusion that is effective in fibromyalgia. But what is important to emphasize that the size of therapeutic effect is similar to that with other recent interventions, such as duloxetine and combination of tramadol and acamol. So it's not that one of those drugs is superior to the other, but you should tailor the specific drug to the patient, and this is exactly what this study has done. They compared the efficacy and harms of duloxetine, milnacipran, pregabalin in fibromyalgia patients, and they came with this conclusion that this article presents comparative data on the efficacy and harms of duloxetine and pregabalin in fibromyalgia. The results can help clinicians in choosing medication since the three drugs have different effects on the key symptoms of fibromyalgia syndrome and different side effects and contraindications. What it means is, and I do it every day, when I have a patient with depression and pain, I choose, for instance, Cymbalta. When I have a patient with pain and sleep problems, I choose Lyrica. So we do it already, but this study has shown that we are doing the right things tentatively.